have developed a path-breaking technology based on the electrochemical DNA biosensor, which can detect infection and antimicrobial resistance. Our guest speaker is Dr. Ankit Agarwal. He is the additional professor in charge ICU at AIMS Rishikesh.
So, thank you for inviting me.
Thanks, Dr. Raghavan, for joining us. Thanks, Dr. Ankit. Dr. Ankit and Dr. Raghavan both are the critical care specialists, and we are very welcome to all of you for joining us for this webinar series. This is the second series of this year, and this is about the infection prevention. We are basically working on the infection prevention as well as the detection. So here we want your thoughts and how important is the infection prevention as well as detection, because Ramja sensor is working on this mission since last 5 years. So we have developed the products in infection prevention and detection series. In the prevention, we have a NANOSHOT. It's a nanoparticle based solution which detect infection in just 90 minutes, which keep the surface germ free for 96 hours. It's a nanoparticle based solution. And our another product is Prathma Sense, which detects infection in just 90 minutes. So before, without delaying, I would like to ask Dr. Raghavan, kindly discuss, ask the questions and just talk about the infections issues in critical care setup in the ICU.
Hi, Dr. Ankit. First of all, welcome you. And first thing is that how you tackle day-to-day in controlling. What is
Before speaking on how to control and how to detect, I would like to speak on what's the importance of infection. Basically, in my past 15 years or so of working in ICU, what I have realized is that everyone is focused on the infection that the patient comes to the ICU with. Maybe it is a respiratory infection, maybe it is a blood infection, and maybe it's a soft tissue infection. So everyone's focus is on treating that infection. But quite often what happens, the infection per se for which the patient has come to ICU, that gets treated. But during the stay, he contracts some other infection. And that is very difficult to treat, and it is detected late. And often it's because of multi-drug resistant organisms, and that's where everything fails. So our whole focus should shift from not only from treating the patient, but for treating the environment of the patient, the ICU environment also, so that the patient does not contract a new infection. It's the real problem. We have been calculating our CLABSI rates, we have been calculating our COTI rates, so it varies. The minimum that we had, past year, the minimum that we had was around 4%, and the maximum that we had in a particular month was 12%. That was despite the best disinfection practices that we are following. So that's the magnitude we are facing even in a tertiary care setup, where we have all the facilities, where we have all the wellness.
So, sir, what is the load in your infection ICU in terms of the bacterial or viral or fungus load in your AIMS Rishikesh?
Yeah, as far as the ICU is concerned, I have my data. Just a second. So basically, we have been calculating our CLABSI and COTI rates. So the CLABSI rate, the minimum that we had was 3.4% minimum, and the maximum it went was 12.8. And if I say about the COTI rate, the urinary tract infection, so last year there was a one single month where we had no infection of COTI. It was 0, but the maximum was 3.2%. So that's the range that varies from month to month based on the turnover patients, based on the type of patients that we get, and based on the awareness of the staff, because our staff keeps rotating. So there are a lot of factors that affects this.
Okay, thanks. It's really very insightful. So as of general opinion, people do think that when they go hospitals, they do get sick also. Matlab, they do go for that wellness, but still sickness is also there. So what is your opinion about, there is an hospital associated infection during admission, during their hospital and ICU stay? What is your opinion about that in clinical perspectives?
See, as such, going to the hospital is not a problem. Patient won't be getting an infection by just simply visiting a hospital or getting treated there until and unless that patient is immunocompromised. But what happens? There is sharing of equipment between different patients. There is sharing of certain furniture like hospital beds or ventilators or like. Now it depends how properly those things have been sterilized or disinfected. That is where the role of hospital infection committee or the quality of care that a hospital is providing, that matters. So definitely, if a hospital is just focusing on the patient part but not focusing on its infrastructure, not focusing on the disinfection part between two patients, then definitely it makes the patient prone for infection.
Hi, Dr. Ankit. I just want to ask you which organism predominates in your ICU?
It's basically four culprits: Acinetobacter, Klebsiella, E. coli, and Pseudomonas.
And do you detect any drug resistant pattern there?
Pardon? I
In
couldn't
any,
hear.
do you detect any drug resistant pattern in there in any means?
Drug resistance, yes, definitely we are facing a problem of pan drug resistance. And even cholesterol, it's very difficult to keep it as a reserve drug because nowadays hospitals are using it rampantly, and even cholesterol has started showing resistance.
Okay.
Or any rapid detection technique you use like biofire or other things?
We do have a facility of biofire in our institute, so often we use that. And recently we have been carrying out a test runner project with the biosensor, and we are just waiting for the results.
Yeah. So basically, that's a great thing. Actually, we are doing a trial with. Thanks a lot for providing that support also. So we have reported one patient in your sepsis, and those was fungus positive on day one. So we were very excited to tell and discuss the reports with the keen doctors. So that's we are looking forward for the good results about that project too. So thanks for the insight and giving us your thought about the biological bacterial load and AMR load in your ICU. So my next question is towards how infection prevention helping hospitals and patients using these disinfections. For example, you said that patient to patient interactions and their beds and all, if they have not been properly disinfected, they may do cause the infections to patients to patients. So, sir, what is the frequency in AIMS Rishikesh in other hospitals is generally to be used for these sanitizations and disinfections?
We have a policy in our ICU that we disinfect every shift. We have a 8-hourly shift of our staff, so we have made a protocol that as with every shift, the shift will start with disinfection. And we have just made this protocol so that no one misses it. The first thing that one has to follow is the disinfection part.
Okay. Yeah, that is very important because until you cannot prevent it, and detection is another thing. Okay. So what kind of disinfectants currently are you getting used in AIMS Rishikesh? What sort of?
At present, we are using hypochlorite.
So, sir, is there any side effects of using hypochlorite?
Side effects per se, apparently, we have not reported any. But
No. Side effect is not like that. I'm just talking about a person who is actually disinfecting on the surface. It's fine, but hypochlorite is per se is an ability to. It's an acidic in nature, so it can spill over and can harm the person who is actually spraying. And if somebody is sitting over there, still it is very difficult. It will be an emergency for them in case if they inhale that kind of things.
Yeah, definitely that's a occupational hazard and an environmental hazard. So either the hospital has to be equipped enough to prevent or to handle such kind of emergencies. But yes, these hazards do exist. We have to be cautious enough.
Yeah, so because these are very common practice and most of the hospitals are actually happening for the infection prevention. So Ramja Sensor is having a solution. Before talking about the solution, I would like to just ask you if you have a solution as capable as your hazard containing solutions like hypochlorite. It can kill the some, it can definitely sanitize your surface, but they don't stay on the surface. As of my opinion, what do you think? If it has been sprayed but somebody has been over there, then that surface will get decontaminated again, isn't it? Yeah. So we are having a solution. We will continue the surface disinfectant for next 96 hours just after one spray, which has been tried and tested. So if this capability solution with the plus point and unique point is non-toxic, what is your opinion about that?
So that's a great concept, I would say.
Yeah, because right now NanoShot is our first and foremost product which is already in market. It is nanotechnology based solution which keeps the surface germ free for 96 hours. And the beauty is that once you just spray and you leave it for 30 seconds, it starts killing virus, bacteria and fungus with the capacity of 99% reduction. And it is self-disinfecting. This self-disinfecting means even you spray burns and someone has come up over there, someone and touched, they have been there at for this place and touched it every there. Again, it will continue to work. It will disinfect. And self-disinfecting capacity of this solution is there. So these kind of solutions are very non-toxic as we have dermatologically tested them, and they are NABL accredited and ISO certified. This is the one product which we are having. And the most important thing of this product, to provide this solution to us, to you, from Delhi to Rishikesh or wherever you are getting your solutions, if you are ordering someone 100 liters. So solution cost is hypochlorite, I know is very less, but getting the 100 liters from the any transport will cost more. It's a transport, logistic, and so many license would be required for getting these things. But our solution is just a coffee sachet. 1 liter solution, we have just lyophilized the whole 1 liter solution in that coffee sachet. So the whenever you are thinking that today the one shift person has come in the ICU, they can just open it, tear it and use it. And it will keep your surface germ free for 96 hours. So this is a double protection. So in hypochlorite, what you are using, it is actually getting diminished by the second shift. But in the NanoShot, when you are using something, it will be making the second or third most impactful layer in the second shift. If you are following the same shift protocol in your ICU, so this solution will definitely help you in. I just want to know the opinion of yours. अगर आपके पास ऐसा solution हो जो कि non toxic भी हो और 96 hours तक रहने वाला हो, what is your opinion? How
See,
it can
nano medicine is the future. Nanotechnology is the future of medicine. The need of the hour is the awareness.
Yes.
And either the people are not aware or they are not, they even if they are aware, they do not know if any such thing is available, accessible to them. So, but definitely, if these things work out and after a trial run or so, then definitely it will outstand any other thing.
Yeah, so that is why the opinion of an actual person who is dealing the day-to-day infections in the critical care matters a lot, because these things brings after credibility. Yeah, please tell our audience for the disinfectant whenever they should go to the hospitals, what should they actually keep in mind? Because most of the time hospital is having their own sort of loads of infections. What is your suggestions as a physician? for the general public, for keeping themselves safe in
See,
this time?
for the general public, as far as OPD visits are concerned, they just visit, they get themselves examined and come back. For that purpose, a simple face mask is sufficient, and most of the infections that are carried over with through hands. We touch various surfaces, doors, equipment, tables, etc., and then we might put it on our nose, hands, or we might eat something. Hand washing and proper cleaning of hands. For the basic hospital visit, these two things are sufficient. These should be mandatorily followed.
Just ask you one question related to the clinical trial which is going on in AIIMS Rishikesh. If this trial gets successful, because before conclusion we cannot discuss about the results and the day-to-day basis reports what we are giving it to you. This is the common platform. If at all this gets successful, what is your chance of giving preference for these kind of device versus the conventional method?
See, I already said that we are having infection in the range of around 3% to 12%. And that's after the best of awareness, and that's after the best of disinfection processes that is available to us and that we are following. Still, we are having 4 to 12% infection. So if the trials are successful and if we get something which further reduces this rate, I think it will be a breakthrough.
That's really, really very important thought, and we are looking forward to actually feedback. What actually the thing is that who people are using, they should knowing, and they actually know the value, how important it is for getting the results in 90 minutes. Because waiting and giving antibiotics as per the set pattern is quite and delaying things for the
Hospital, as far as any treatment is concerned, and more so if critical care treatment is concerned, and time is the gold there.
yeah.
So if we lose time, we lose patient. So we at present it takes around 3 to 4 days for the culture reports to come. So anything if we have that gives us a report within 90 minutes, that it's almost instant, I would say. So again, it will be just wonderful.
Okay. Thanks a lot, Dr. Ankit. Thanks a lot for your time. I know time in the critical care schedule is really very difficult. And me and our whole team of Ramja and Samrit team is also there. We would like to say thanks. And Samrit team is supporting us for all this Pan India trial. Their vision is with us to do this Pan India trial so that we will get that more authenticate results. So I would request everyone, whoever is available, can you just please switch on your video so at least Mr. Aniket is our USA team and he's taking care of the Samrit. Please, you can talk some.
Dr. Ankit, thank you for your time, and it was a very enriching session, though I joined like 5-10 minutes late. But yes, I heard that the technology that we are discussing is good, and thank you for allowing the Pratmasen solution to be deployed in AIIMS Rishikesh, and we hope that the trials are useful for the hospital. Thank you.
For our only Pratmasen or any device, but definitely the infection is per se very important issue to take in care. So we are having a mission just to making awareness in the society that you can reduce infection by prevention also and getting detection in 90 minutes. And I would like to say thanks to all of you. Thanks a lot for giving us your time. Thank you.